Hello, hello. I'm Masood Alam Apollo. I'm from Bangladesh. I want to request COVID-19 about. I want to tell about COVID-19 all over the world, especially UN. I request to UN Secretary, United States, Indian government, EU, European Union, and all over the world because the coronavirus in the pandemic. So, if we want to save from coronavirus and from if we save from disaster of our economy, I request all the government of the world, all the countries. I request, please listen to me. So far I stop. How can we save from how can we save from the coronavirus? The coronavirus, if we want to save our economy, if we save our lives, if we save our world, then at first we have to trace who is the carrier of this coronavirus, who is the people, who's those are the carrier of this coronavirus. Then suppose India, suppose United States. Who's the man, the carrier? You don't know. But there is the symptom. There is some symptoms of coronavirus. If you have the symptom of coronavirus, then you have to separate. You have to separate from this whole people who is the carrier of this coronavirus. Suppose uh, suppose US United States, there is 20 crore people. 20 crore people. Okay. Total people are carrier in the coronavirus? No. It may be 2 lakhs, 5 lakhs, 3 lakhs, 8 lakhs, 10 lakhs. Okay. You have to separate from these others. Who is this carrier of this virus? At first, you have to separate from these others. Then, these people need quarantine, home quarantine, isolated, test, and treatment. Here is the four step. This these people who is the carrier of this virus, COVID-19, this is the people. At first, you have to separate from this total population. Total population. You may have 50 lakhs, 50 lakhs carriers of this virus. Okay, there is no problem. How can you separate this? Your government should a package, two packages. One is the subsidy package. Those who get this test or enlist this coronavirus, coronavirus to the government, and two packages. One package is the subsidy package. One package is insurance package. Two packages. There are two packages. If you apply, if you get, if you get treatment, if you want to get treatment, if you want to test, if you have the symptom, then you have to connect with us. The government has the hotline. This those people who are thinking that's the I have this career, I have this some symptom, then he or she contact with this doctor or hotline. Then 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 you are these people. At first you have to think this, do you this career of this do you have career this of this symptom, do you have these symptoms, one or two or three symptoms, coronavirus symptom? Then if you have this symptom, please please go the home quarantine, please go the isolation. Please, if you isolated yourself, if you know opportunity isolate yourself, please take a government isolated facilities. If you have no if you have no if you don't understand this is symptom, this government should telecast, government should publish This is the symptom. One or two or three or four or five. One symptom is the primary symptom. Pick, okay, you have to isolate it. You have to go home quarantine. Number, if you have two symptoms, coronavirus COVID-19 symptom, please you connect with this doctor, nearest doctor or government, please, or health section. If you have three or four, please go and get test. Then you have to if you are the carrier, if you are the patient of the COVID-19, you have need a test. So if you want to separate the who is the carrier of this COVID-19, then you have to announce two packets or more packets. One package is the subsidy package for this population of this country, for the citizens of this country. Or number two, you have to announce a big amount. You have to announce a big amount of subsidy for the COVID-19 carrier or a have a symptom. Number two, if you announce for your citizens a insurance package, this two package or more package can help you to separate this carrier people, carrier who is the carrier of those COVID-19 and these others. After the separate those people, you have to free of the lockdown. You have to stop lockdown relaxations. Then you have to save your economy. Then you have to save your peoples, save your lives, save and stop this coronavirus. There is no alternative. There is no alternative way to stop this coronavirus. At first, you have to separate these people. At first, you have to separate these people. You have the total population. How can is this possible to the India 30 crore peoples is the lockdown under the lockdown? Is this possible? It is not possible. It is possible to separate. Suppose India 50 lakhs carrier of this COVID-19. Then you have to first what you have to separate who is the carrier from other citizen. Then you have to this 60 lakhs population, you have to take care, you have to test, you have to home quarantine, you have to isolate it. So not only India, I request all over this country, I request all over the countries of this world, not only India, not only Bangladesh, not only US, all over the world should have to follow this idea, I request all to for like and share to so that everybody can watch this video, because this is the way, this is the only one way to separate these people. It is the only one way to separate this separate from this fresh people. So everybody, UN, WHO, World Health Organization, I request you should take a necessary to step all over the world. US, I request to US, I request to Italy, I request to Spain, I request to EU, Africa, Asia, and all over the world, all over the government. I request to follow these rules, follow this system. You have to, at first, you have to separate of this total population from this carrier. Who is the carrier? You have to trace. At first, you have to trace. Then you have to test and test and test. Test and test. You have to know. You have this symptom. You have this symptom. Do you have symptom? Those who have this symptom, those who have the symptom of this COVID-19, then have to separate us this others people. This is the way to stop this coronavirus, to have to save from the disaster of this economics. We have to save lives. Now the world goes to the a dangerous situation. In this moment, we have no medicine, we have no vaccine. if we get it, we have to wait 1 or 2 years. That's just long time. In this time, until we get until we get vaccine, thousands of people may die. Thousands of people may die with hunger. Thousands of people may jobless. The economic will be disaster. Economic will be disaster. All the ecosystem of this world may destroyed. I request you, all this doctor, all this government, of this policy maker, please, I request you, and I request all of us, the viewers of this video, please like and share for others, for yourself, for others, or for your families. Please give a share. Please give a share. If you understand or not, please, if you want to save your family, if you want to save your economics, then you have to share our lives, so that this video is spread all over this world. This is only two way. You have to announce a huge package. You have to announce a huge package for coronavirus. Who is the carrier? One is the subsidy package, two is the insurance package, this life insurance package. After his death, he will realize, after his death, his family will save, his family will get this money. That is the way to separate the who's is the carrier from these others. This is the way. I request, and another request, all of this world, all of these people who is this my watching my video. Thank you for watching my video. Thanks, and save you. Please stay in home. Please stay home. Please inform to your health section. Please inform your government. Please inform your nearest hospital that you are this carrier, that is you have these symptoms, you have 1 or 2 symptoms. If you 1 or 2 or 3 symptoms, please immediately contact with this nearest hospital or national health service or any other hotlines. Please, I request all over these people, and I request to all to stay home, to save your family, save yourself, save your economics, save all this world. Please, I request all over I request all the peoples of the world. Please stay home and save home. Please stay home and save your family, save your world. This is the good job. If you stay home, and if you have 1 or 2 or 3 symptoms, please contact of this immediately nearest hospital. And I request all the government of this world, and the UN and UN secretary. I request UN secretary and United States as the president, and Chinese president, and all over this strong powerful country. Please announce the 2 package for these patients who are this carrier, who has the symptoms, for two package. One is the subsidy package, and 2 is the insurance package. To separate this, separates those the people who are the carrier of this COVID-19 from others. Thanks a lot for watching my video. Assalamu alaikum.